Welcome to Channel 17, the Town of Colonie Government Channel.
Hello and welcome to Focus on Health. I'm your host, Peggy Mello. Today's guests are Michele McClave and Richard Nacy with the AIDS Council of Northeastern New York. Welcome to the show.
Thank you.
Michele, can we start with you? What do you do for the AIDS Council?
I'm the executive director, so I oversee all the internal and external operations of the agency and work with the board of directors.
Okay, and Richard?
I'm the Director of Development and Marketing, so I oversee all of the fundraising, communications, public relations, and outreach that the agency does.
So you two are very busy people. All right, let's talk about the history of the AIDS Council. How long have you been in existence?
Actually, 2009 is the 25th anniversary of the AIDS Council of Northeastern New York, so
Great.
We're just getting through our 25th year.
Okay, and what is your coverage area?
We cover 15 counties of Northeastern New York. We have 5 offices to serve that 15-county region. It is a region the size of large as the state of New Hampshire.
New Hampshire, yes.
So it's a pretty large region from the Columbia and Greene counties to the Canadian border in the north with to Plattsburgh in the north, and then to the west to Fulton, Montgomery, and Schoharie counties. So it covers a pretty diverse, very, very rural and urban areas. Some of the most rural areas of New York State are in our region, and then we have, downtown Albany we cover as well.
And is the AIDS Council a nationwide organization?
No, but we are one of 14 community service providers in New York State. So we're a New York State designated community service provider. There are 13 other community service providers in New York State covering the entire state of New York. They're all separately incorporated nonprofit organizations, but we all are designated by New York State Department of Health to be the AIDS service provider for the regions that we serve, or the areas. In New York City, there are 5 that cover different boroughs. And so that we were initially created so that anywhere in New York State that someone who has HIV or AIDS has somewhere to go for correct information, for referrals, for help, for support, and that HIV prevention is occurring throughout the entire state of New York.
Okay. And who is the clientele? Who can you help? Is it any age group, any kind of patient?
Well, in our client services, we have two components to our mission, or 3, including policy advocacy. But HIV prevention is one component of our mission, and then direct service to people who are actually living with HIV and AIDS. So on the client service end, you need to be infected with the disease and have a need. Some people, a good number of people with HIV or AIDS are able to take care of their own needs, to get to their doctor's appointments, to make their own decisions, to can live in their have homes that and jobs and are self-sufficient. The clients that we see have a need, some kind of a need for coordination of services, for access to benefits, for help getting to doctor's appointments or negotiating that system.
Yeah.
But you have to be HIV infected to receive our client services.
Now, is AIDS considered a pandemic across the world?
It is. It definitely is. You see instances of HIV infection and AIDS throughout all corners of the globe. Our main focus obviously is in Northeastern New York, and New York State is still the epicenter of the AIDS crisis here in the United States. We have more people living with HIV/AIDS than any other state. sort of on the think globally, act locally scale, we have a lot of work to do right here in Northeastern New York in terms of preventing new cases of the disease and serving the people who are already infected.
Do you have numbers on infection in the United States and the capital region?
Currently, I think it's 1.1 million
Infected
in the United States.
33 million worldwide, 1.1 in the U.S., and in New York State, 150,000 people living with HIV and AIDS. And in our region, the region that the AIDS Council serves, we have 3,000, projected to be 3,000 cases of people living with HIV and AIDS. And a concern is that 20% of people who are infected do not know that they actually have the disease. So one of our great initiatives is testing and to get people to know their status.
And can you just explain the difference between HIV and AIDS, just so we understand?
HIV is the virus. So if you're infected with the virus, you don't necessarily progress. I mean, the disease takes a long time to progress into what would be called CDC-defined, Centers for Disease Control defined AIDS. You have HIV, you become diagnosed with AIDS when you get an opportunistic infection, a whole list of infections that qualify, and when your T cells, your T cell count and your CD4 count reach certain measures, certain levels. If they go below 200, for instance, for your T cell count, which is your immune response measurement, or your viral load is, if your T cell count is under 200, you're diagnosed with AIDS. And so a lot of people can live with, and that's the problem, people don't know they're infected because you might become infected, get flu-like symptoms for a couple weeks, and then you seem fine. So you don't have some people do not have any other kinds of noticeable symptoms up to 10 years. So when the disease works on your immune system and works to break down your immune system, and then eventually you'll become, your immune system will not be able to fight off infections, cancers, that kind of thing, and you'll end up with full-blown AIDS.
So they may not die specifically from AIDS. They may die from something that, because of their compromised immune system.
Right. A lot of our clients if they get cancer, for instance, they really don't do well. They're fighting with a compromised immune system. They're trying to fight the cancer, so they might end up dying from pancreatic cancer, for instance. But the HIV is what accelerated their death or did not allow them to do as well with treatment, with cancer treatment. If you have other infections, if you're co-infected, for instance, with hepatitis C, which a good number of our clients are, though your hepatitis C might progress much faster because you have HIV infection. And then the drug cocktails that they are prescribing for HIV infection try to work on all the things that might be going on with you, and they measure your viral load. I mean, how much of the virus that you have in your system, and they work on trying to bring that viral load down to what's called undetectable, and your immune counts up. So then your body's acting more like having a normal immune system. So they try to keep it there as long as possible and as often as possible, so that if you were to get a cancer or some infection, you'll be able to fight it off, and they can give you chemotherapy, and you'll be in much better position to fight any other kinds of diseases. But people are still dying from AIDS, and there's several thousand deaths in New York State every year still. So and they're trying to figure out what kind of the life expectancy is for someone who becomes HIV infected has shifted and changed, and they're projecting that there's a loss of up to 20 years of life now. with HIV infection.
Interesting. Now, what about predicted numbers for the future of HIV and AIDS infection?
Well, we saw an increase of, in our region, new cases, 7% increase of new cases in the last year. So it's a behavior-based disease, which means people transmit it from one person to another. So we have more people living with HIV and AIDS than ever before. So there's more people who potentially could pass HIV onto another person. So it's ever more important that we are vigilant about talking about HIV, that it is not taken care of, that it is not easy to live with, that you don't want to get it. And our concern areas are, in particular, young people, because they weren't around in the early days 20, 25 years ago when people were getting infected, dying quickly and dying in very devastating ways, so very visibly devastating. So they don't have that image of HIV and AIDS being something you really don't want to get, so they're a little bit more laissez-faire about it. They're, oh, you can take a pill and you'll be fine. So it's really, really important that we talk about the realities of HIV infection, especially to young people. Almost half the cases in our region are among people under the age of 35, which means with that 10-year window of moving forward, that a lot of them were infected in late teens and early 20s. So young people taking risks and getting infected and then having to live with this, with a shortened lifespan, for one thing, and then having to live with the many, many complications and consequences of becoming infected. They don't think about many of the things in their future. They don't think about family future. They don't think about job future, travel, any number of things that you might want to do in your life will be impacted by HIV. So that's one concern area. We have another concern area that the good thing is people are living longer with HIV, which means people are aging with HIV. So we have, and we're going to have, a larger percentage of people over 50, over 60 who have HIV and AIDS. And they'll have aging concerns, osteoporosis, heart problems, diabetes, all the other problems that come, which will be, again, much more complicated and need much more sophisticated care and treatment because they have the HIV infection as well. And these care systems, nursing homes, home health systems, day systems, I don't think are prepared and ready and thinking about taking the aging HIV population in and what their needs are going to be, which are going to be different.
Absolutely.
So it's kind of on both ends of the life spectrum.
Okay, now I'm sure the AIDS Council offers many services, right? Can you talk about your current services that you provide?
You want to take that?
Sure. Michele referenced earlier that we have client services and prevention services.
Right.
So from the client side, we offer really comprehensive A to Z services for people who are living with HIV/AIDS. Everything from assisting them with getting into medical treatment to working with a case manager so that they stay on their treatment regimen. You name it, we will provide transportation so that people living with HIV/AIDS can get to their doctor appointments. We also have resources to provide transportation to other essential appointments. So it's one thing to get them to their doctor, but it's another thing to also get them to their sort of day-to-day things that they need to do. We provide mental health counseling for people who are living with HIV/AIDS. We do a lot of work in terms of substance use and sort of making initial determinations if substance use treatment is needed. There's a lot of sort of cross issues with people living with HIV and substance use, so we want to make sure that they have all the resources available to them. So if they have a problem that they need to address, we can help them address it. Housing is huge. Housing is, of course, a big issue. We always say that if you don't have a roof over your head, you're probably not going to be that concerned about staying on your course of treatment. So we work very closely with our clients to make sure that they have proper housing. We will provide assistance, financial assistance in terms of security deposits on apartments and rental properties. We have great resources in terms of emergency assistance for our clients. We're very heavily grant funded, in terms of New York State and in terms of the federal government. However, those grants are very restrictive in what we can provide for clients. So we may have a grant to provide housing and a bed, but a house and a bed isn't enough. You need to make sure that they have sheets and blankets, especially when the weather gets cold.
And food.
Food, absolutely. We are set up in our offices with small food pantries, so that if people find themselves on a Friday afternoon kicked out of their current living situation and they need food to get them through the weekend until they can get to one of the food shelters the food pantries throughout the region, we have resources for them.
I'm trying to imagine myself as a patient with AIDS and all of the challenges that I would be faced. Do I have a job? Can I afford the rent? Can I afford food? Can I hold up my relationship that I have? Can I afford my medicine? How much is a triple cocktail that you take per month? How do you afford it?
Well, it's interesting that you mentioned, the cost of treating HIV, because we just found out that over a person's lifetime, the medical costs are over $1 million just on medical treatment. And about 70 to 75% of that is for pharmaceuticals and drugs. So it is not only not an easy disease to manage, but it's also an expensive one.
Well, I'm imagining if I had a choice between paying the rent or getting my medicine, I'd probably pay the rent.
Yeah, a lot of our clients do have poverty as an issue and the complications that come in living in poverty, and we help try to support them in addressing those essential needs so that they can take care of their health, and then also to work with them so that they don't pass HIV on to other people. But we're lucky in some ways in New York State has a good coverage for people who have HIV for medical care. And there's a Medicaid program which covers a lot of the medications and care and treatment for people with HIV who are poor. And then we have ADAP, which is AIDS Drug Assistance Program. So that's for people who are working and who make I think it's under $44,000 a year or something like that, that there's supplemental help to help people pay for medications through that ADAP program. So that those two things have have allowed people in New York to get early treatment, to get proper treatment, and so we're way ahead of other states in a lot of ways in in care and treatment for people with AIDS. In some other states, there are waiting lists for to get into their ADAP program, so that means people are not getting medication. They're not getting medication that they need. And the studies have indicated that early identification and early treatment of this disease is essential, that your life expectancy and your outcome are going to be much better if we find it early and you start treatment early. There's still concern that we're finding people, especially in some of the poorer areas, finding people who are HIV infected and they're diagnosed with AIDS within 6 months. That means that we're finding them really, really late in their infection. And then they've lost all that time of being able to get treatment to improve their chances and their outcome.
I'm imagining that it must be difficult, it must be a challenge for your client services to deal with the different clientele. They're under stress, they're depressed, they're addicted. to something? They're taking, I'm assuming they're still taking their drugs. I don't know if they are or not. They're homeless. How do you contact them? How do you make sure that they're not on a drug binge and, you know, they're not going to their doctor's appointment? I just can't imagine how you do it.
Well, we have case managers, and they're very talented people. They really look holistically at the whole person when they walk in the door. What is the presenting problem? And often the first times that people come in to see us, HIV is the last thing on their mind. They've so many other problems, and we have to help them deal with those other problems first. I try to find them housing, get them into substance abuse treatment if that's what they need, get them mental health support, food, shelter, out of domestic violence situations, whatever the situation might be that's going to prevent them from going to taking care of their HIV. Because our ultimate goal is then get them into HIV care and treatment. You know, recovery readiness is a big thing for our case managers. They work with people who a lot of times have a history of substance abuse. We do not turn anybody away if they're actively using. We will work to try to get them into treatment and follow them through treatment so that they're successful in their treatment. And, you know, we've seen people who have incredible stories. They have, you know, relapsed and relapsed and relapsed maybe 10 times, and then this one last time that our case managers work with them, they make it through, and it's the time that they remain sober and move on with their lives and get jobs. And so we've seen some incredible stories of people overcoming amazing odds and living with this infection at the same time.
Wow, that's interesting. Okay, now how about prevention services?
We probably don't have enough time in this interview to talk about all the prevention work that we do.
We only have 30 minutes, I'm sorry.
One of the things that, if I can speak personally for a moment, is when I first started working with the AIDS Council, and I sat with our Director of Prevention Services and got the scope of what we do to do prevention work and education and outreach in the community, I was flabbergasted, and I still am to this day. What I think sets our prevention efforts apart is that we don't sit in our offices and wait for people to come to us. We go out into the communities that are most at risk and hardest hit, really, and do prevention education, everything from testing for HIV to STD screening, safer sex supply distribution. We are out there in the communities that are hardest hit, and you know, one of the communities that was certainly impacted earliest, and to this day is still severely impacted by HIV, is the gay, lesbian, bisexual, transgendered community. We have a program called Project Hope. HOPE stands for HIV Outreach Prevention Education, and we go out into the gay, lesbian community to provide our services. We talk about testing and doing testing in the community, and it's not just that we provide a test. We don't just, you know, take a swab and wait 20 minutes and give the person being tested their results. During that time, before the test is taken, and while they're waiting for the results, we're talking to the person who's being tested and sort of doing an individualized risk reduction assessment. What are they currently doing? What little steps can they take maybe to reduce their risk of contracting HIV or other STDs, and sort of putting a little plan in place for them so that when they get their test results, be it positive or negative, they're ready to take the next step, either to go out and change their behavior or go out and get into treatment. So in addition to Project Hope, we have a number of programs that work with communities of color. There are some communities that don't really feel that HIV or AIDS applies to them. So we have one program called Given the Chance, which allows us to get in to the community without using the words AIDS Council or AIDS or HIV, and still offer services, testing, prevention education in a way that's non-threatening. One of the great things that I like about our prevention work that we do is that a lot of it's done on a peer-to-peer basis. So we will have people who have been through one of our programs, either HIV positive or sometimes HIV negative. We will train them to go out into their communities and talk to members of their community. And it really, it's one thing for me to go into a community and say, hey, you might want to think about doing this. But if it's somebody who lives next door to you and who's sort of living the same life that you are, talk about steps you can take to reduce your risk, I think that's significant and much more powerful.
Okay. So that's everything for prevention, huh?
Well, that's not even close with prevention.
One thing to note, we also have an adolescent-focused program, and we try to get adolescent peers to talk to their peers about why they should change their behavior and why they should be safe. And because, we know they don't listen to us.
They won't listen to us.
But they will listen to their peers, and we try to change our goal is to change cultural norms around safer behavior. And in the adolescent area, talking to kids is the way to do that. They set their new norms about what's okay behavior, what's acceptable behavior, and what's not.
Okay. How much, Michele, how much resistance do you guys get in the community? I mean, do you go to a high school and hand condoms out, or, do the parents call you and say, what are you doing?
Right.
Are you crazy?
Yeah, because we have so many school districts in our region, it's impossible for us to go into all the schools, so we've kind of chosen and not to take the tactic of doing a one-shot deal at a school. Instead, we're working with high-risk youth in the after-school programs, in the Boys and Girls Clubs, in the drop-in centers, and those kinds of programs to get those that are probably already out there taking risks. We work with teachers, though, and other human service providers to try to get them to incorporate HIV prevention messages in all that they do. Or when a kid comes up and asks them a question, they have correct and accurate information and resources to go and share with that youth. So, because we don't have the resources to be all places to all things. In schools in New York State, there's a K through 12 curriculum for HIV prevention. Good. So all the schools are supposed to be doing the K through 12 curriculum, and there's at different developmental levels appropriate information that's supposed to be provided to the kids. Now, they're probably happening better in some school districts than in other school districts. We think that's essential, that the school districts take it on and talk about it as a health concern for youth. So, and parents can go, actually, we have a teen website, and teens and parents can go on there. There's teen-friendly language and messages, and parents can get information if they have questions. Parents can call our hotline and say, I think my kid might be doing such and such, or he or she came to me and asked me this question and I don't know how to answer them. You can call our hotline and get a real person to answer, to help you figure out how to talk to your child. The most important thing for parents is to talk to them. And
it's hard enough to even just talk about doing it.
Right.
Talk about sex.
Right.
You can't even go any further than that. It must be difficult. All right. Richard, why don't you talk about the events that the AIDS Council holds every year?
Yes,
they must be so exciting.
I have the fun job. I really do, because I get to throw a couple of really great parties throughout the year. And we start off our year in April. The last Thursday in April is Dining Out for Life Day. And Dining Out for Life is actually an international event. It's hosted in cities across the United States and into Canada. And for one day, restaurants throughout the capital region and beyond, throughout most of our counties that we serve, restaurants get together and they say, okay, we're going to donate 25% of our proceeds to you for this day. And we receive 25% of the proceeds, usually just for dinner, sometimes lunch dinner, sometimes breakfast, depending on what the restaurant serves. And in return for that, what we do is we promote their restaurant like crazy, and we do a big marketing campaign to drive diners into the restaurant. And it's a lot of fun because in order to participate, all you have to do is pick one of the restaurants and go dine out. And it's really easy. It's a lot of fun to do. We also have ambassadors that we station in each of the restaurants who go around each table and thank the diners for coming out and ask for a contribution as well. So it really is a great community event and something that people can get behind without having to do, you don't have to pick out an outfit. You don't have to rent a tuxedo.
Thank God.
You just have to go out and go out to eat. So that's a lot of fun. Our other signature event that we do takes place in November, also a Thursday. It's always the third Thursday in November, which is the Thursday before Thanksgiving, and that's our annual Beaujolais Nouveau wine celebration, which is grown into one of the Capital Region's signature events as well. People look forward to this event all year long. How it works is this. On the third Thursday in November, the Beaujolais vintage is released to the world, and so they ship it in from the Beaujolais region, France, and we have an event where we have tastings of the new vintage. We also have a couple of other places provide wine and spirits for us. But in addition to that, we have a bunch of restaurants come in and provide samplings from their menus. So it's a great, big, fun, joyous evening of food, wine, entertainment. We're incorporating more live music into the event. It's fabulous auction so that people can, so that people can, start their holiday shopping early. And this event has just become more and more enjoyable and more well attended every year. So that's our other signature event. We also are involved with AIDS Walk. And that's usually the end of September. And throughout the year, we do fundraising appeals where we simply ask people for contributions. All of our events and the sort of letter writing campaigns that we do, they all fund our Client Services Emergency Fund, which provides emergency assistance to our clients. We don't currently raise enough to cover all of the requests that we have for emergency assistance. So my work is cut out for me, and our board of directors helps us tremendously with fundraising. We have a number of community advocates who assist us in planning events. We have some great committees. Our marketing committee and our development committee help us out, and we're always looking for people to volunteer. There's another fundraising program that we do that's completely volunteer driven, and that's called Help Fight AIDS Through Books and Music. And it was started nearly 2 decades ago. A gentleman by the name of Steve Kozlowski approached the AIDS Council and said, hey, I want to have a book sale of used books and music and to benefit the AIDS Council. And at the time, the board said, sure, why not? Exactly. But since that first book sale, Steve and his team of volunteers have they've netted more than $500,000 to benefit the AIDS Council. It's not just about the dollars with that program, although the dollars are very important. One of the great things about Steve is that he instills the values of volunteering and philanthropy in the hearts and minds of the people who work with him. And he's affected hundreds and hundreds of people and gotten them to volunteer over the years. So he does book sales at Stuyvesant Plaza, the Book House, throughout the year.
Good.
Book sales in the Empire State Plaza throughout the year. During the holiday season, he's got people doing book wrap and selling entertainment books. He's just a wonder, and everyone involved with that program on a volunteer basis is just really special.
Wow, that's great. Now, what about the charitable giving opportunities?
Yes. I'm so glad you asked. We provide a number of sort of vehicles, if you will, to help people living with HIV/AIDS in Northeastern New York. The first one is really through our annual appeal. And our annual appeal is becoming more of an annual campaign each year, rather than just sort of hit people up during the charitable holiday season. We're trying to reach out to them throughout the year and give them more opportunities to give. And again, those funds that we receive through the annual fund, the annual campaign, if you will, go to our Client Services Emergency Fund. We are always looking for people to donate stock or appreciated securities, if you will. It's a great thing to do if you are facing a tax burden. Doing something like donating your IRA or stock to an organization like us, like the AIDS Council, can really help you come tax time. You know, we're sort of getting our feet wet in terms of what's known as planned giving, and that's making a gift to the AIDS Council through your will. And there are a number of vehicles that we can work with you and your financial advisor and your legal representation to make that happen. So you can give to the AIDS Council online through our website, www.aidscouncil.org. On the right side, there's a button that says Donate Now.
I hope it's flashing and has lights.
It's right at the top, yes.
That's a good idea.
So there's a, you know, and you can call us at the AIDS Council and we'll talk to you about making a gift. And, you know, we're ready. We're ready to accept.
Now, you've mentioned a number of different events and ways that volunteers can help. So
Yes.
you just have tremendous opportunities for volunteers, I'm imagining.
Volunteers really are they're the backbone of an organization such as ours. We have several hundred people who volunteer for us, you know, between the Help Fight AIDS through books and music and through volunteers who work with us on a particular event. But we are always looking for help in any way, shape, or form. If we have an opportunity, we will match a potential volunteer up with something that will interest them and make them feel like they're making an impact. It's one thing to go and stuff envelopes, and that's wonderful and that's fantastic, but it's another to go through that process and then be part of the event that you were stuffing envelopes for and seeing, oh wow, this is what my volunteer work led to. So we really try to make the experience meaningful and make people feel like they've made an impact.
Can I just add, also volunteer, our board of directors is, of course, all volunteers, and we're always looking for folks to serve on our board, and we have 5 board committees. That's, you know, a little bit more of a time commitment and more of a professional role in the agency, a governance role for the agency, an advocacy role, a fundraising role for the agency, but someone who has that kind of interest and time, we'd be looking for members for committees and for board. Internships also, we like to keep a lot of interns at the agency to help us in all levels and all areas, finance and administration, fundraising, and direct service. So opportunity for someone who's in school to do an internship. And then right now we have our holiday sponsor program, which is adopt a family for the holiday, basically, we have a list of clients in need, and to match a donor or a school group or a work group with a family in need for the holidays.
You guys have a lot of stuff going on.
We do. We do.
Okay, we need to quickly mention a lot of information. For further information,
Absolutely.
there are phone numbers and websites.
Sure.
So, Richard, this is your job.
All right, well, for general information, you can call our hotline, which is 800-201-AIDS, AIDS. We also have a local hotline number, which is 518-445-AIDS. Our main administrative office is in Albany. If you had a question about you want to make a gift or you're interested in volunteering, you can call that number. It's 518-434-4686. And the receptionist will direct you to the appropriate person. Websites. I already mentioned our main website, which is www.aidscouncil.org. There's a whole host of information on there. If you're newly diagnosed, there are resources, and there's a button on the right-hand side of the page that'll take you to where you want to go. If you're looking for testing locations, there's a button that says Get Tested. And if you just happen to want to make a donation, you can click the Donate Now button and get to where you want to go.
Okay.
We have a fantastic website for teens, and that's www.hivoutreach2, as in the number 2, teens, and that's .com. You can get to that page also through our main website. There's a button for it. We refer to that as the teen hotspot, hot being HIV outreach to teens. We also have a website focused on the GLBT community, and that's www.rubbaboyz.net.
Okay.
And also our Help Fight AIDS Through Books and Music program has a website, and that's www.helpfightaids.com.
Wow.
And we just did with the teens who developed, created, and starred in a public service announcement. And that website is www.thepricesyourlife.com. You get to see all the components of that awareness campaign, including the public service announcement that they created, which is wonderful.
And I would be remiss if I didn't say that we caught the social marketing bug, and we are on Facebook. You can look for us at AIDS Council of NENY on Facebook, and we're also on Twitter. We have a Twitter page. We Twitter daily, or tweet daily, I guess you would say, and that's you can search for us on Twitter at also at AIDS Council of NENY.
And if anyone has any questions, they can call Richard or Michele.
Absolutely.
All right. I thank you guys for everything that you
Thank you.
do for your community. It's really fantastic.
Thank you.
Thank you for having us.
Thanks for watching. We hope to see you next time on Focus on Health.